I've been actively involved politically in many things for a long time. Right now I'm working with Senator Wyden, Mike Rosen, who's the Cleveland Clinic, on Senate Bill 1640. And what it is, it's an effort to pay physicians for disease management when 75% of a health care cost is disease management. And we point out in this bill that if we concentrate just on some 4 different areas, we concentrate on cardiovascular disease, coronary disease, type 2 diabetes, metabolic syndrome, prostate cancer, or breast cancer. There's a series of 11 things you have to meet as a practicing physician. If you meet these standards, they'll pay you up to $7,000 a year. If you get this person involved in a program, keep them out of the hospital, the government will reimburse you that amount. And the CBO estimate, if we get this program implemented over the next 5 years, we can save the American taxpayer $1 trillion. Anybody talking about that? No. Don't hear a thing about that. All I hear is too much care, too late. And if you're stupid enough to think that the new plan is going to reduce the cost of health care and it may provide better medical service, you're very foolish. The health care costs are going to go through the ceiling. Very concerned about that. But also I'm concerned, as RJ mentioned, about what's happening in America regarding our fitness, our wellness. The first book came out back in 1968, and we had less than 24% of our adult population exercising. We had less than 100,000 joggers in 1968. The book came out, Aerobics, coined the word 1966, became an international bestseller in 1970. And there were the critics. Some of my medical colleagues said the streets are going to be full of dead joggers as more Americans follow Cooper. Concerned about that. What happened? We jumped from 100,000 joggers in 1968 to 34 million joggers by 1990. We saw not an increase number of deaths from heart disease. We saw a 48% decrease during that time. Only 3 countries had a comparable statistic: Australia, Canada, New Zealand, in that period of time. We increased our life expectancy 6 years in 22 years. Ordinarily should have been just 2 years, up to 76 by 1990. Why? Because 76 million baby boomers born between 1946 and 1964 led a health revolution we'd never seen before nor have seen since. What did they do? Quit smoking in great numbers. Starting to have their blood pressure measured, had it controlled. They changed their diets, lowered their cholesterol, learned the harmful effects of stress and how to control it, exercise in great numbers. Look at that in reverse. What's the best way to control stress physiologically? I've done for over 55 years of my life is exercise at the end of the day. I'll soon be 79 years of age. I still work 60 hours a week. Number 2, the best way to increase the protective type of cholesterol, the HDL cholesterol, is aerobic exercise. The best way to protect you from developing high blood pressure and treat high blood pressure early is aerobic type exercise. And the best way to break the circus smoking habit permanently is start an exercise program. That's what happened. But what happened in 1990? They lost interest. They stopped exercising. And we've seen an obesity epidemic in this country since 1990 that has blown us out of the water. Only 40% of adults were obese in 1990. At the present time, we've got 76% of our people overweight or obese, of which 36% above 30 pounds overweight. I'm happy to say the only state in this country that's maintained that low level of obesity has been the state of Colorado. I applaud you. You still have in the order of only 14 to 15% that are overweight or obese, which is amazing, obese in your state. There are now, these states have more than 30% of the population above 30 pounds overweight. Louisiana, Mississippi, West Virginia, South Carolina, Oklahoma, and Tennessee. It's going the wrong way. Along with that has been a marked increase in adult onset diabetes. Obesity problems, heart disease going up, diabetes going up, relationship between cancer and obesity, we know that, on and on and on, metabolic syndrome, all these various things. It's going the wrong way. Too much care, too late. We're not preventing these diseases or we're managing diseases. We're not doing that. So what has happened? We've seen that the cost of health care is going up, but we've also seen other things that are occurring too. And that is the obesity epidemic that we have in America, not just Americans around the world. We're seeing obesity in our children like we've never seen before. I want to spend the remainder of my time talking about a subject which is very dear to my heart, and that's childhood obesity. Because I have given up, literally, I'm sorry to say, on obesity, controlling the obesity problem in America. There's been no state that's seen any decrease since 1990. Some states have flattened out. You flattened out in Colorado. But most states have seen a sharp increase. No state since 1990 has had a decrease in obesity in their state. That's true. I've traveled the world. I've been overseas 3 times this year. I was speaking in England not long ago. Just got back 2 days, just yesterday, from a trip down to the Antarctica for another reason. I see worldwide interest in what we're doing because we're beginning to get some results in Texas in a unique way. On 2 occasions, I was nominated for Surgeon General of the United States because George Bush, my patient for over 20 years. So back in 2001, I was nominated for Surgeon General, and I couldn't accept the position because I'd had to sold the aerobic center in Dallas, the highest bidder. Wouldn't do that. But in 2006, when I was doing the annual exam, Fort Bethesda up in Washington, on the president, and Carmona just retired. He said, Ken, he asked me, will you consider being Surgeon General again? So the 15th of September, I was back up in Washington in 2006, right, worked the HHS secretary. I said, I want to concentrate on childhood obesity, adult onset obesity, diabetes in children and adults, the cost of health care. And Levitt said this. He said, Dr. Cooper, we want you to concentrate on AIDS, avian flu, and bioterrorism. I said, why is that? That's not what's killing us. He said, yes, but there's been 9 bills submitted by members of Congress trying to do what you want to do since January 2005. 1 by Ted Kennedy, 2 by Bill Frist, 1 by John Cornyn, 8 bombed out in subcommittee, and 1 died in the House. I can assure you there's no interest in Washington in what you want to do. He said, go back to Texas, slip in the back door, and see what you can do there, and see if we can control this escalation of the cost, or escalation of obesity. Our children, 12 to 19 years of age, 6 to 19 years of age, has gone from 4% to 16 to 18% at the present time, with 40% of the students in Texas, 6 for statistics in America, that we rank number 6 in the nation as far as obesity is concerned. So I came back and I went to our governor, my friend Rick Perry. I said, Rick, let's do this. Let's do what the HHS secretary said. Let's see if we can slip in the back door and can start something in Texas that will spread across this country. He said, Doc, let's do it. So working with Senator Jay Nelson in Flower Mound, Texas, we introduced Senate Bill 530. And what it did for the first time in years, brought PE back into schools. We haven't had PE in Texas for 15, 20 years because with No Child Left Behind, they thought we got to eliminate PE and replace with math and science to increase the grades in the schools. It's all backwards, I'll guarantee you. So again, we had this bill that required bringing it K through 8. It was 30 minutes, 5 days a week, 45 minutes, 3 times a week. There's various options that we had. But then I got blasted, I'm sorry to say, by the schools, the superintendents, the principals, some of the teachers, the art teachers, beauty teachers. They thought if we bring PE back into school, we'll lose our jobs. Or at the contrary, I had the medical profession, the Diabetes Association, Heart Association, all in favor of it. So what do I do as a legislator in the state of Texas? It's a game they play. It's called a mandate without funding. So what they do is they say, they try to tranquilize these people, realize as both sides vote, they want to lose their votes. Sorry to say that's a game that they play. So what they do is have a mandate without funding, and they tell these people, don't worry, 95% is never funded, don't worry about that. They tell these people, don't worry, we did the best we could do. If it's not passed, it's not my fault. They forgot one important thing, is that I testified 4 times for the legislature. Okay, if that's the game you're going to play, I need $3 million to equip 9,000 schools in Texas with the equipment to do the testing. I needed 20,000 teachers. I have to train them to do the testing start in January 2008. If you won't fund it, I'll fund it myself. $3 million. Thanks to Jim Loprino over here, made a major contribution to get this thing going. And we raised $3.1 million in 3 months. Never been done before. We started in January 2008 testing. And we use what's called the FitnessGram test. We've been promoting this since 1982. It's the first test ever to test kids from 3rd to 12th grade in testing functional fitness, not athletic ability. We test their endurance capacity by a shuttle run for the elementary schools, by a 1-mile walk run for the other schools. We check their percent body fat by skin-fold measurements, our percent body fat or body mass index. We check upper body strength, lower body strength, 6 different tests, and all you have to do to pass the test is rank the top 80 percentile, age and sex adjusted. Since 1982, we've been doing this around the world. So we started our program in Texas. First of all, they said that, okay, you're going to have a lot of fight among the school superintendents and all trying to get this done. You'll be lucky to get 30% of the schools to respond. Because if you have a law, a mandate without funding, they won't do it. There's nothing else, there's a penalty, they won't do it. So again, we got it funded, got it in, and we were surprised 84% of the schools responded. Out of 3 million students, we tested 2.6 million kids. Unbelievable. From the 3rd to the 12th grade. Guess what we found? From the 3rd to 12th grade, the percentage of kids that could pass